So let's make way to actually talk about the pharmacology of what amphetamine. Okay, and amphetamine is basically a drug that we saw on a glance when we are talking about indirect acting sympathomimetic drugs. Okay, so here you can see that I read that let's talk about the pharmacology of amphetamine, also known as an indirect acting sympathomimetic drugs. So let's basically understand it from the first principle. What is a sympathomimetic drugs? Is the one that will basically what act to trigger the sympathetic nervous system. So an indirect acting one now is basically like not acting directly on the receptors, but increasing, but is actually acting to increase the level of what neurotransmitters. Okay, increasing the endogenous neurotransmitters of what sympathetic nervous system. Okay, so amphetamines is one of these indirect acting ones, right? So we'll be talking about it from the definition to the mechanism of action, therapeutic use, side effects. Okay, and that will be enough to call it a pharmacology for this drug. So amphetamines are central nervous system stimulants, right? They stimulate the sympathetic nervous system. They are used to treat what attention deficit hyperactivity what disorder. That's the ADHD and narcolepsy. Okay, and all these medical conditions are due to like reduced levels of what um, norepinephrine, noradrenaline, all right, or reduced levels of what all those neurotransmitters for sympathetic nervous system, right? So you want to give them so that they can increase the secretion of the neurotransmitters, all right? So adverse effects of this drug include restlessness, acne, blood vision, right? Mostly when it is given in excess, right? So rarer side effects include seizures, heart problems, psychosis. Amphetamines are used for recreational purposes too. Okay, so this is what amphetamine. Don't focus on any other thing. Just focus on this amphetamine. That's just what we're talking about, right? And this is how the structure looks like. All right. So this amphetamine, talking about their mechanism of action. Like I told you, they act indirectly by increasing the levels of what the neurotransmitters at the synaptic cleft. Okay. So they help to release what stored noradrenaline and dopamine from presynaptic terminals. All right. So now released noradrenaline causes what vasoconstriction, raising blood pressure via the stimulation of our beta 1 receptors. Okay. So now therapeutic use, just like we said, they can be used for what attention deficit hyperactivity disorder and narcolepsy and appetite suppression. All right. They basically work toward increase the levels of what the neurotransmitters for sympathetic nervous system, thereby solving these medical conditions that are due to reduce neurotransmitters for sympathetic nervous system. Do you understand? So now there are side effects now. Psychological and physical dependence, psychosis, confusion, insomnia, headaches, restlessness, palpitations, you being aware that your heart is beating, tachycardia, that's basically increased blood pressure, and impotence. Okay, these are basically the side effects of what these amphetamines. All right, and I'm actually trying to look at pharmacology of amphetamines. All right, mechanism of action, therapeutic use, and side effect. Okay, so guys, that's it about this pharmacology of amphetamines. See you guys in the lectures to come.